No doubt this is a tough time for a whole lot of people. Whether you know someone who's dealing with damage out west, worried about loved ones, or are just really sad about the destruction in the mountains, it can take a toll on you mentally. Here with us tonight is clinical psychologist Dr. David Gutterman with Cone Health LeBauer Behavioral Medicine. Dr. Gutterman, explain how an event like this can really play a role in someone's mental health.
Well, it's obviously very traumatic for anyone listening or hearing about the devastation that's taking place. But I think particularly for people in our area, this is in our backyard. It's so close to home, and so many of us know family, friends, and familiar people that live in the area. So it takes a much tougher toll because it's so very personal.
This might seem like an obvious answer to a question, but why is it that when we see others who are going through something so terrible, we are so affected by that?
Well, again, we tend to project ourselves in those types of situations, and so often these tragedies, they seem so, again, very far away geographically. This being so close, many people can relate to it, especially so many people who have visited the area. They've been to our mountains and they're seeing familiar places they've been to with their families that are just devastated, and that adds really to the trauma that everyone's experiencing.
I'm glad that you brought up, everybody has been to the mountains, one or the other. And I think that, seeing something like this happen to a really popular vacation spot, it can be difficult to process the shock of seeing these places once you've visited them, now to see that they're gone. How do you process that?
Well, I think it's very difficult. It's going to take some time. I think that one of the most important things is for people to, again, focus on the resilience of people right now. I think rather than focusing as much on the devastation, it's on the recovery efforts. And just like you on your station, you've been mentioning all the things that people can do to participate, be part of this process of helping our neighbors and rebuilding is so vitally important. And it just seeing this level of devastation makes you feel very powerless, and that will in turn help you feel like you're in fact doing something to contribute to the solution.
We've been learning about the dozens of people who have died following the storm. How can we all process and mourn those lives lost?
Well, this kind of loss it's so devastating, and it's the individual losses, right, that so many of us will be talking about, again, with friends and neighbors and relatives who've lost loved ones, but it's also the larger loss, really the loss of sense of security and safety. I mean, all of us were experiencing various minor levels of this, horrific storm as it went through, but of course they were hit so very hard. I think. But I think it'll be in the days and weeks from now to really begin to process what this loss means and how devastating it really is as it starts to unfold day by day, as we get more messages, more images from the area. I think people need to be prepared for that, because right now we're seeing some of the major devastation, but over the coming weeks, I'm sure we'll be seeing many more images, and we have to limit how much of that we're going to really expose ourselves to.
So what would you say is the best way to do that? How do you limit, or how do you process this as we continue to learn more and see more over the coming weeks?
Well, I mean, I think, again, we can limit the images just by, how much we expose ourselves to what we're watching. But I do think it is important to stay informed. And I think, as I was saying a few moments ago, I think one of the best ways to really to do that is to be focusing on recovery efforts. I think that is something that helps keep people energized and involved and really feeling like they are, because they are in fact making a difference. So the more involved we can stay, what's going on, stay in touch with, again, the news stations, faith communities are all coming together. And there are lots of different ways that we can be involved, whether contributing money, time, food, whatever it is that we can do, I think helps us feel much more a stronger sense of community.
So, Doctor, what are some coping mechanisms we can use to help with these big life events, these big natural disasters we see?
I mean, everyone's going to be a little bit different, right? There's no one particular type of coping mechanism. But I think all of us have to be able to manage our own experiences. So number one, it's very important to again recognize and not just repress your what your feelings are about what's going on. For many people, this is a traumatic event, depending upon their own histories, if they've had histories with different types of losses. And so first, again, don't deny, how you're feeling. Talk with friends, talk with family about what's going on. We're getting a lot of input, a lot of data is coming at us, but it's important to be able to express, what your feelings are, what this is all meant to you as we continue to get more information and things unfold.
I would imagine that, for a lot of people, they see what's happened out west and they might almost feel a sense of guilt because it is happening to others, not the same way that it's happening to us. I mean, how do you process something like that?
Well, there are certainly feelings of guilt, so almost like a survival guilt in the sense that the storm passed us and hit others. We are so used to some of this when we see these things happening on the coast. I think somehow the mountains is it's pretty unique to see this sort of thing. We've become almost accustomed when it comes to the coast, but it makes everyone also not just guilt but feel very vulnerable. And I think that's part of the most significant part of it is that everyone feels a little bit more vulnerable when you see these things happening. And what it does is it causes you to start thinking about, well, what if it were me? And what would I do? And how did people not escape? And do I have alternatives if something like that were to happen here?
Speaking of vulnerable, what would be a population of society that would be the most vulnerable to something like this?
As I was referring to a little bit earlier, that folks who've had significant losses, especially traumatic types of losses, be it through storms or accidents like that, uh, uh, especially if those losses have been relatively recent, within these last few years, because we're seeing so much grief and so much loss that that particular population is going to be especially vulnerable to having a traumatic response, which would mean things like anxiety, sleep disturbance, appetite disturbance, that sort of thing.
As adults, it's easier for us to process, what we see happening out west. But how do you talk to kids about a natural disaster like this and just the process that we're all going through to save people?
Well, it's a great question because you're exactly right. Kids will process things very differently, and we should not make the mistake of assuming they have the same level of understanding we do. So first and foremost, um, ask your kids, whatever age they are, whether they're teenagers, young adolescents or younger. Ask them what have they heard, what are they hearing at school, what are their friends saying, so get their understanding of it and what their feelings are about it before you launch into assuming you can understand whatever it is you believe that they're interpreting. So understand where they're at and then make sure that they do in fact have the facts at whatever age level is appropriate for them, because they're going to be seeing and hearing a lot about this because again it being so close to us. So they're going to see collections and all these things that are taking place, and they need to understand it. But what they also need to understand is again how we come together as a community, the resilience of people, the resilience of our community to come together and help each other out. So we want to focus on more of the positive than anything else.
Whether it's now or days or weeks down the line, what are some warning signs that somebody's mental health might really be, affected by this long term?
Well, I think and it's important to recognize again for ourselves as well as our friends and family that very typical anxiety symptoms. So a sense of nervousness, especially related to things like storms. But the anxiety, you'll hear it in people's language and the way they talk in terms of their anxieties. If they are perseverating, meaning they're repeating over and over the same kinds of worries and concerns. You'll see some sleep disturbance. If someone's being re-traumatized from a recent loss that they've had, and then seeing all this devastation and loss, you might see them, slip into more social isolation, being a little bit, less verbal and pulling back from people. So you just want to look for signs that people's behavior is outside of the typical way they normally are reacting or carrying out their day.
All right, some important insight, Dr. Gutterman. Thank you so much for your time. We do appreciate it. If you'd like to watch our conversation again, we're going to be posting it to the WFMY News 2 YouTube page coming up later this evening.